Hi, my name's Rob. I'm an occupational therapist advanced practitioner, and I work here at the Cavell Centre, which is adult inpatient mental health and learning disabilities. So I'm very fortunate to have a split role with a few different responsibilities. I have a clinical time with clinical caseload. I also do the service development for our team and the management as well of the therapy team. And part of that management is about developing people. So developing people through their career journeys in terms of kind of education and knowledge, but also apprenticeship and occupational therapy degree apprenticeship programs. I really enjoy the developing people aspect of my role. It's really satisfying to see people come with the kind of the core set of values and characteristics that we want people to do the role, and then develop by adding knowledge and understanding and kind of the use of the maybe more of the scientific practice. So our therapy team is made up of occupational therapy, peer support work, and our gym instructor. And the thing that we're really fortunate about is that the combination of those three professions allows for a really integrated plan for an individual patient. So we're thinking about people's physical health, we're thinking about levels of physical activity and all the benefits that brings, and we're also thinking about the recovery tools that a peer support worker can establish with people. And all of that is kind of underpinned by the values and the therapeutic relationships and the types of intervention offered through occupational therapy. We're very fortunate to have a gym and a sports hall for physical activity. We also have a therapy garden space that we use for gardening here at the unit. Public allotment that we hire across the road as well for patients, so that we're kind of allowing people to access outdoor and green spaces as part of their therapy. We have a cardio wall. It was donated very kindly by Head to Toe, and that is a piece of cardiovascular equipment that allows us to support people to exercise and to enjoy exercise who may not otherwise have participated, because of the kind of the nature of it means we can wheel it around, it's mobile, it's kind of a friendly competition sometimes between the people involved, and that we're all exercising without necessarily being conscious that that's what's happening. Well, the most rewarding part of our job is definitely the patient's journey. The people that we work with here are often, in really severely distressed state emotionally and mentally, and understandably it's one of the most challenging times in their lives being admitted here. And seeing the intervention and the connection that can come from a therapeutic relationship, building trust with people, starting with very, very small interventions and seeing that grow into people developing living skills, and even beyond into being able to enjoy themselves, doing things that actually bring some relief to their symptoms and their distress, is just, really inspiring, exciting to see.